I would say across all the nootropics on my channel, Phenibut hands down would be the most controversial. People either like it or they hate it. This nootropic is one of those trending nootropics that is just becoming so popular year after year, and that's why I gave it a try. I'll give you a quick glimpse of what the powder looks like. It almost looks like a salt. You can see it's like a white kind of texture here, and it doesn't really taste that bad. This is in most cases available both in powder form and in capsule form. Why do I prefer powder? I just do, given that I can accurately dose it with a milligram scale. Although, of course, if you are to take it in the capsule form, it'll feel naturally the exact same. So during this video, we'll discuss the benefits. I'll talk about the side effects, the dosage, and then stay tuned to the end of the video where I'm going to share with you some nice alternatives for Phenibut for general calmness, anti-anxiety, and having better sleep. First, let's address the question of what is Phenibut, and it's similar in composition to the brain chemical GABA. So research and a lot of reports have shown that it lowers anxiety, it enhances mood, and also produces other positive health-related effects. It decreases anxiety while not having any negative effect on cognition. So a lot of people use Phenibut in a way as they see it as like an alternative to alcohol. So the same kind of loose feeling you would have under the influence of alcohol, they say to some extent you'd feel that with Phenibut. As far as general anxiety is concerned, being in your head, it seems to like lower inhibitions and can therefore make you more social. So one way people really like it is they call it almost like a party nootropic. But that's also one of the reasons why I am not the biggest fan of Phenibut, because it's not something I would really take during my workday. What I find is that when I'm using Phenibut, it's almost like my discipline kind of diminishes, my willpower is gone. It's not a nootropic that will make you like lazy or unproductive, but you'll just find yourself kind of focused on distractions outside of work. Everybody has their most important tasks that they know have to get done. Whereas with Phenibut, it's almost like you're so curious about things outside of work that makes it such that you'll find it very difficult to resist temptations. And that's one reason why I kind of feel like Phenibut is the opposite of Modafinil. And here's why I say that. It's because with Modafinil, you're very good at doing work independently. So for example, if you're like a bookkeeper, or if you're in your own office space, like an environment when you're not talking to many people or having phone calls, you're just really behind a computer, that's when Modafinil shines. But where Modafinil does not shine is specifically for interactions. You'll find it's difficult to be a good listener, it's difficult to build rapport, and you really just don't have patience for people. Phenibut, I say, is the opposite, because with Phenibut, you can get that kind of work done where you're by yourself, but the work you would want to get done is more like social work. As you're more outgoing, you're more curious about people, and you just find yourself naturally more extroverted. For bodybuilders out there, bodybuilders obviously don't want to consume alcohol, given that it can do some funny things with your hormones, it can lower testosterone levels, and it can essentially make it such that it inhibits your ability to build muscle and can cause you to actually gain fat versus lose fat. So bodybuilders, they say in theory, can use Phenibut to get that same feeling of being a little bit loose, feeling like life is an adventure, and just having an overall happier baseline, you can say. The appropriate dose is going to hinge on several factors, and these include the user's age, the user's body weight, the user's state of health, and you can say your general sensitivity to nootropics. For example, I would consider myself somebody that is sensitive to nootropics. It's almost such that most nootropics work with me, and I can tell that they're working within a couple of weeks. However, there are a number of supplements that I know don't work for me, so I am obviously conscious of the placebo effect, and I'm sure that you are as well. So a smaller dose for people would be something like 200 milligrams to 300 milligrams. Then something on the higher side would be something like 1 gram. And then anything over 1.5 grams is generally not recommended. However, there are reports of people doing this, and some people seeing good results, some people, again, not noticing much, and some people, of course, having very severe side effects. So the way in which you take it is really up to you, because with Phenibut, it's great in that it won't put you to sleep, but people may use it prior to sleep. So that makes it such where it's not a stimulant, it's not going to keep you up. And there's people who often report taking Phenibut before bed and having a really good night's sleep. But at the same time, there's people taking Phenibut like right in the middle of the day and feeling calm, being out of their head, and being overall just more present. Unfortunately, Phenibut is known to become really easily tolerated by the body, which is the problem in that people may eventually become addicted to it. Phenibut is one of those nootropics that you can even use just prior to, you can say, significant events, like for stage fright. I wouldn't recommend it to somebody that's obviously going into an exam, but perhaps if you're going into a meeting or you're making a presentation and you're a little bit uncomfortable with that, that's where Phenibut can be effective. So for that reason, I can understand why people may try it during different portions of the day. Some of the benefits, again, they include like insomnia, post-traumatic stress disorder, stress, tension, symptoms of depression, even alcoholism, fatigue, anxiety, fear, even appetite control. And I do agree with that, as I used about 500 milligrams of Phenibut just prior to this video, and I'm finding that I have no hunger whatsoever. And let's talk about the side effects, and we've only covered pretty much the pros of Phenibut so far. Let's talk about the cons, and here's the problem. I would say across all the nootropics on my channel, Phenibut hands down would be the most controversial. People either like it or they hate it. My last video on Phenibut had a lot of negative comments, as people didn't even want me talking about the stuff given that it had such bad side effects. Believe this, there's even a subreddit just dedicated to people that are quitting Phenibut. It's called r/quitting Phenibut. Isn't that funny? There's a lot of different side effects that you may read about with Phenibut, but some of the more common ones are dizziness, like body restlessness, nervousness, and sometimes symptoms of depression. But if you were to ask me, Michael, about my thoughts on the side effects, the root of the problem really is just that people are not using it responsibly. They're taking far too much, and they are not taking it infrequently. Rather, they're taking it too frequently. If somebody was using Phenibut, I would think like maybe a couple times a week is good enough, maybe just to catch up on sleep or have a general nice feel of calmness. So it's strange in which there's not really side effects, it's just the problem is that there's withdrawals. But as far as like side effects themselves are concerned, once you're taking it, you can sometimes feel this like dry feeling in your face, almost like your cheeks are sucked in a little bit too much, which of course can be somewhat uncomfortable. I found there's sometimes when I take it and my mouth is so dry that no matter how much water I drink, it just doesn't make a difference, and I just have to wait until this dry mouth sensation is gone. But otherwise, I sometimes have felt headaches in the past. And then there's the more common side effects you would expect from withdrawals from like something like Concerta or Adderall, and that you just feel tired, a little bit lazy, and in a worse mood. Let's now address alternatives to Phenibut, especially for those of you that are trying to get off of Phenibut if you've taken it for a considerable period of time. There's a lot of them which come to mind. Aniracetam comes to mind, ashwagandha, lemon balm, maybe L-theanine. But of everything, the two which I can think of which are the most effective when it comes to just alternatives for Phenibut itself, the first one comes to mind is lemon balm, and this is one of the newer nootropics that I've started taking, and it's very powerful, it's very potent stuff. One tablet is 500 milligrams. I'll give you a visual of it. I don't know if you can see that. It's like this beige brownish color tablet, and you take 2 of these before bed, and what you'll find is you can sleep a lot better, you're calm, you feel this overall like body relaxation. It's a nice feel. This would be the most similar to Phenibut. And then the second nootropic which comes to mind is ashwagandha. This is something I've been consistently using for years. Ashwagandha is different than Phenibut and lemon balm in that you wouldn't necessarily always take it before bed, because it's also a nootropic which can make you somewhat more productive. You find that when you're taking ashwagandha, then you're just happier, you can more likely see the brighter side of things, and you can go about your work in just a more unattached state overall. This is the KSM66. I think it's the most popular form of ashwagandha. I really like it. And here's how it looks. I don't know if you can see that. It's like this orange, yellowish color texture. Please do click the like button and comment below. I want to know what your favorite alternative to Phenibut is. And the way I'm going to end you up is with this video of ashwagandha right here. Click into the card if you want to go see that video. Take care. Practical. I've found that when I'm not taking ashwagandha, at the end of my workday, I feel exhausted, like I'm drained. I don't look forward to the next day. Whereas with ashwagandha, I just finish the day feeling very fulfilled. I've helped a lot of people. I'm looking forward to doing this tomorrow. You feel just more in alignment and sort of on purpose. What's